Everybody, we are just at the top of the hour. We'll give just a bit further time for people to log on. So thanks so much on behalf of the University of Colorado Cancer Center, School of Public Health, the Colorado Cancer Screening Program for Patient Navigation, PNTC, who's helping support the work, as well as our clinical partners at University of Colorado, as well as Fight CRC, who I know has helped promote today's event. Thank you for everyone for joining us today. We're going to wait. I know we have over 70 people registered, which a number of folks might be coming for the recording later on, but we'll just give another second for folks to jump in before we make our formal presentation today and introduce our speakers. I just want to say Elsa Weltzing is on today, Aaron Martinez from University of Colorado as well, who are going to be helping support today's webinar. And then I just wanted to do a few introductions, but we'll also do just a quick few announcements before we formally turn it over to Dr. Lieu as well. So given that we are right at the top of the hour, everyone on behalf of the Colorado Cancer Screening Program, I am Andy Dwyer. I'm going to be facilitating today's conversation, but most of the time will be spent with Dr. Christopher Lieu, who is one of our great leaders within the GI team and oncology team at University of Colorado. So we're thrilled to have Dr. Lieu joining us today. Elsa Weltzing is going to be sharing information in the chat related to the upcoming opportunities through CCSP. So I know a number of our navigators as well as friends are on October 20th. For those who are involved in the CCSP program and anyone who'd like to join, we'll be continuing our peer sharing work around lung cancer screening focus. That will be shared. Registration will be available. A reminder of a save the date that the Lung Cancer Task Force and Cancer Coalition will be doing the Coalition Mini Symposium virtually on November 5th as well as November 12th. Those dates will be available in terms of the Lung Cancer Screening Symposium. There will definitely be more information coming soon through the Colorado Cancer Coalition and the symposium as well. So the mini symposium on the 5th, I will say for the coalition, the full-scale conference itself has been delayed for probably a spring-summer actual event, but the mini symposium will feature, I think, several of our national partners and state-level leaders, just to give a glimpse of what's happening within cancer in Colorado as well. So pretty excited about that. And just a quick reminder, PNTC and Aaron's on the line will be doing the level 1 training online starting October 20th. So if you are a CCSP participating clinic system, this will be covered under the grant. So a reminder that that's coming forward. And I believe Aaron and Elsa will be sharing information about how to register. So all kinds of fun stuff through the coalition, all kinds of stuff through CCSP, as well as with working with the PNTC. Aaron, anything around technical support before we turn it over to Dr. Lieu?
Hi, yes, I just wanted to let everyone know I do have the captions auto-enabled, so those are there for your reference. However, if you would like to turn them off, just navigate to your bottom Zoom toolbar and hit the CC button, and you can say hide subtitles. The chat function is also down there, so feel free to chat me individually if you need any tech support. You can also put questions in the chat during our presentation, and we'll make sure to get to those. And in the bottom left corner, you'll find your mute and unmute button. We ask that you stay on mute during the presentation, but when we do get to our Q&A portion, if you'd like to come off mute and ask a question, we welcome that. Thanks.
All right, awesome. And a huge thanks to Aaron for being with us today as well. So, and I'm sorry, Elsa's audio is not working, but Elsa's going to give everyone a quick wave right now. Hello, Elsa. Yes. And so a reminder that if you have anything CCSP related for the launch of the new fiscal year, or there's anything related to additional programming, our team is available. So I just want to say, you know, we're really excited to have Dr. Lieu. I think since the pandemic really, I guess, kind of entered the scene, Dr. Lieu has been great, giving the cancer community a sense of what's going on with COVID, what's going on with screening, what's going on with the pandemic in general, hospitalization, what it means for cancer survivors, cancer patients. We're also now at a point where we were talking vaccines. I know Dr. Ernest and Dr. Lieu provided some perspective when vaccines were just first being actually available. And actually at the time, I think only maybe even available mostly for people who were only immunocompromised. But we do know that there's a number of questions that are coming up now related to the vaccines, boosters, as well as what can we expect, particularly as cancer patients or those of us who are working in the cancer screening, prevention, treatment, or even survivorship and supporting folks either through any of that continuum. Like, what do we say? What do we do? So we're really excited to have Dr. Lieu giving us some perspective. I know that we just received Chris's updated slides just a few minutes ago, and I think he reminded us that really things are changing. So the information is good, it's timely, but there will probably continue to be great updates, and we'll learn more from Chris about how to really keep tabs on this moving ahead. So Chris, a million thanks. I'm going to turn it over to you. Like Erin said, we'll have questions at the end. But I know that you've already started even proactively in the presentation, started responding to some of the questions that we knew that were coming up. So Dr. Lieu, it's all you.
Well, thanks for that kind introduction, Andy, and welcome everybody. Thanks for taking time out of your busy schedules to talk once again about COVID. You know, I think that I had initially given a presentation to this group in the spring of 2020, and probably never thought that in the fall of 2021 we would still be talking about this and having the hospitalization rate that we are having. But it's been a nice transition to talk about obviously the start of the pandemic and how awful that was, to start talking about vaccines, and now we're obviously talking about boosters as well. So I hope you guys will find this informative and hopefully we'll answer some of your questions. But feel free to ask questions either at the end or put them into the chat as well. So I'm not going to take a ton of time on this, but I do want to give a brief update on COVID and Colorado. We'll talk about COVID-19 and specifically UC Health, because I think that's just kind of indicative of the state of hospitals in our state. And then talk about obviously the COVID-19 vaccination as well as booster shots as well. So this shouldn't take more than about 15 or 20 minutes, and then we can talk about any questions that you guys might have. All right, so COVID-19 in Colorado. I always start out every single one of these talks with talking about the 1918 flu. And obviously this was essentially the last pandemic that we had to deal with. And you see on your left, the way that different cities dealt with the pandemic in terms of social distancing. And you can see such a gigantic difference between Philadelphia and St. Louis in terms of the peak of the sheer number of deaths that people were experiencing with the 1918 flu in Philadelphia versus St. Louis. And obviously with earlier social distancing, you can kind of see that St. Louis was spared this gigantic peak, but that the pandemic lasted for just a really, really long time. And that's kind of reflected in this graph on the right. And that is, you know, this idea of, you know, being able to handle hospitalization rates by kind of flattening the curve. And you have these real nice kind of even, you know, peak curve on the left, and then this really nice kind of rolling hill curve on the right. And I actually show you this now to show you how different our experience has actually been with COVID-19. And so what you see here, and this data is from the New York Times and is accurate up to about 3 days ago, but it basically starts at the very beginning of the pandemic and then it comes up to now. And you can see, instead of like this gigantic peak and then this fall off or this kind of long kind of rolling line, instead you get these series of peaks kind of showing you probably a couple of things, right? Number one, that we're really, I think, accumulating data at a rate that was probably completely unheard of in 1918. So this might be just a more accurate look of what happens in the real life. But really, you can kind of see the impact of actually the way this impacted different parts of the country, as well as the impact of the different variants. And of course, the one that we're talking about now is the Delta variant, which has hit obviously many other countries before it hit ours, but it's certainly impacting our country now. But you can kind of see that, of course, the amount of cases reported is totally dependent on the number of tests that you have. So it's likely that this initial bump that you see in March, April, and May is actually a lot higher. We just didn't have enough tests available to know what the actual rate was. Then you see this another peak in the summer of 2020, and then this unbelievably gigantic peak in the winter of 2020 into 2021. And then really, you can kind of see the true impact of the initial efforts of vaccination as you go from May into the summer. And this is where the lull happened. And this was great, right? This was kind of where we're on our way to kind of getting back to, what would be considered a more kind of normal state of operations. But gosh, you can kind of see really since June or July that there's this rapid increase, and you're really, really seeing the impact of a highly contagious variant, which is of course the Delta variant. And then with each of these peaks in terms of the reported cases, you can see that the testing rates increase with these peaks, the hospitalization rates increase with this peak. And unfortunately, of course, the death rate also increases with this peak. And the one thing that I'll kind of point to here is that it does appear that we probably hit our peak cases from this particular wave earlier in September. Because so even if you look at the hospitalization rate, which is the bottom middle graph, you can kind of start to see this curve start to trend down. And that's the kind of trend that we obviously want to see. But boy, it's been really, really rough. When you see how it's impacted the country, of course, it's not homogeneous. And so this is a very kind of heterogeneous impact across the country, right? So if you kind of see where we are in Colorado, you can see that there's certainly been an impact, but maybe nowhere near as, say, right, Wyoming, or even, right, the southeastern states. And then you kind of have these pockets in Oregon, Washington, and Nevada. But you can also see this area where, right, California has looked a little bit better, as certainly the Northeast has. But this is a really, really interesting graph in terms of what the pandemic looks like in terms of how it looks like across the country. Here in Colorado, this is the Colorado 7-day moving average. So these are COVID positive tests. And again, you can kind of see these peaks, right? This peak in the spring of 2020, another peak that's a lot smaller in the summer of 2020, and then this gigantic peak that you see kind of in the middle of your screen. And then here you can kind of see what Colorado's look like. I will tell you that our state has fared, in all honesty, much better than others. But this is certainly a peak that has been reflected in our hospitalization rate as well. So that's what this graph shows you. It's really interesting that they can really track this very, very well. Just a reminder, this graph doesn't go from the very beginning of the pandemic. It actually starts at December 2020, so our winter. So that's why when you look at this dotted purple line, which is the number of all beds available within our hospital system, and the green dotted line, which is the number of ICU beds available, you can see how high the hospital resource utilization was in December of 2020. And then you can kind of see a little bit of a kind of jump up in the hospitalization numbers from May to June. And then again, another lull until you get into August. And then from there, you can see that the hospitalization resource use has increased pretty dramatically. And that dotted line kind of shows you not only where we are today, but where we're kind of projected to go. And so here, the Institute for Health Metrics and Evaluation, the IHME, suggests that our hospitalization resource utilization might increase a little bit and then start to decrease after that. It is also interesting to kind of show you that the ICU hospitalization rate or resource utilization here is pretty high, even when you compare it to the winter last year. Don't ask me how they totally track, right, Colorado mask use, but you can kind of see what mask use looked like in the winter of 2020 into early 2021. And you can see this precipitous drop off, right, as we get into the spring, where people basically stopped wearing masks. And you can actually see a little bit of a bump up in August, as obviously the hospitalization numbers and the testing numbers all increased. But you can see that the mask use is nowhere near what it used to be in a winter. And it's kind of hard to imagine that this is really going to rebound in any significant way. Social distancing also reflects kind of what you saw in that last graph. And that is, right, that there's a pretty significant decrease there's a significant amount of social distancing that you saw in the winter. But then as we got into the spring and the summer, you can see that people are pretty much kind of coming close to typical mobility. So the world is ongoing, despite the fact that this variant has, significantly impacted how many COVID positive patients that we have and what our hospitalizations look like as well. This is all measured by cell phone mobility data. So it just tells you that, right? There's a lot of tracking that's going on that can be measured. So, all right. So what about our hospital here? So COVID-19 and UC Health. And I just use this mainly as an example of where, kind of most of our hospitals are in terms of the resources that are required to take care of patients with COVID. And so what I'm showing you here is the UC Health hospital system has several hospitals that are kind of positioned across the state. University of Colorado Hospital is the largest one. And you can see on this chart on your right that University of Colorado Hospital, and this was a couple days ago, had a current census of 70 patients. And you can see that in the system, 265 patients are admitted and being cared for with COVID-19. Some people ask, well, if your hospital has about 700 beds, does 70 patients with COVID really cause that much of a disruption? And the answer, unfortunately, is yes, because it's not just the patients with COVID that are in the hospital, but of course, everybody else, right, that's in the hospital, whether it's for operations, whether it's for heart attacks or stroke or pneumonia, the general population takes up a good proportion of our hospital beds. So when you talk about 265 patients that otherwise wouldn't be hospitalized, and this is a big number for any hospital system to take in. I think this graphic is probably the most telling graphic that I'll show you in the entire presentation. And that is, if we kind of say 246 patients are hospitalized, of the patients that are hospitalized within our system, 203 are not vaccinated and 43 are vaccinated, which kind of tells you two major things, right? That this is a surge that's driven predominantly by patients that are not vaccinated, but the 43 vaccinated hospitalized patients do tell you that there are breakthrough cases, and I'll show that to you in a subsequent slide, that there is a certain number of breakthrough cases. And when those patients do get sick, they oftentimes have other medical conditions that do make them high risk. When you look at the number of ICU cases and ventilated patients, again, a vast majority of these patients are not vaccinated, and only a handful are actually vaccinated, or of ventilated patients have been vaccinated. All right, in terms of breakthrough cases, I think that this is of interest to a lot of people. So Colorado really has done a good job, and this is kind of more recent published data, coming from August in terms of how many breakthrough cases there actually were. So what this data kind of shows you is that if there are 102 vaccinated cases per 100,000 people, when you look at the unvaccinated population, there are 361 unvaccinated cases per 100,000 people. So, when you look at vaccine effectiveness, there are breakthrough cases. And in fact, a lot of people on this call have probably seen breakthrough cases themselves in friends and family or in other people. But the simple fact is that you are 3.5 times less likely to become COVID positive if you've been vaccinated, 4.8 times less likely to be hospitalized for COVID, and 5.8 times less likely to die from COVID. And so this is the data that we show to kind of tell you two things, right? Number one, we just really want people to get vaccinated because of these statistics. And then number two, right? I mean, the vaccines aren't perfect, but if you can tell me that you're decrease your chance this significantly to either get COVID, be hospitalized from COVID, or even die from COVID, these are certainly pretty powerful statistics to kind of look at. So what about the COVID-19 vaccines, right? Those that are on this call, and certainly everybody in the world has been touched by cancer in one way or another. The one thing that I usually tell our patients is that, listen, we actually had the BioNTech and the Moderna vaccines in cancer clinical trials here at the University of Colorado all the way back from 2016, where we're actually giving these vaccines. It's just obviously they were not for COVID. We were actually trying to train them against cancer. And so what was cool about these vaccines is that when they were kind of retrained towards COVID-19 as a clinic, we had a ton of experience with these types of vaccines because we were trying them in cancer. It turns out it's a lot easier to target the spike protein on COVID-19 than develop a successful cancer vaccination. But this is actually an exciting field in cancer where I do hope that you'll see more and more cancer vaccines as they continue to build on this platform. So, I think we had talked about COVID-19 vaccines before with Dr. Ernest, but we're just going to focus a little bit more on the booster, right? So COVID booster shot is just an additional dose of the vaccine given after the protection provided by the original shots has begun to decrease over time. And we know this, right? Your antibody levels have a tendency to decrease over time. And so the booster is just there to rebound those antibody levels to a pretty high state. So typically you would get a booster after the immunity from initial dose naturally starts to wane. And the booster is really just designed to help people maintain their level of immunity for longer. Now, there's a decent amount unknown, right, about the booster. And that is, are you completely dependent on those antibody levels for protection? Can your body, when exposed to COVID, regenerate those antibodies very, very quickly? And these are all things that are still under investigation. And I will tell you, the one general theme, right, from a lot of this is that we're continuing to learn as we go on. And so that's why, as Andy said, these slides have a tendency to change pretty pretty rapidly. And so I almost try to timestamp these slides as much as possible, because it is possible that a week from now, these slides would become out of date. When we think about who can get a third dose of a COVID-19 vaccine, this is a long list. But the one that's, of course, of most interest for this group is, of course, any patient that's under active cancer treatment for tumors or cancers of the blood would be eligible for the third dose of the COVID-19 vaccine. And really kind of what you're looking at here are basically patients that have any type of immunosuppression, right? That have any impact on their immune system. So that's why, right, if you're taking high dose steroids or you have a stem cell transplant or an organ transplant, these are the things that can really impact your immune system and make you obviously more susceptible to any infection, but of course, COVID-19 as well. So would a third COVID shot have to be the same brand of the vaccine that I got originally? I think ideally the answer is yes. So if you receive Pfizer, Moderna, then your booster would be the same. I know here at the University of Colorado, it is predominantly the Pfizer vaccine that's being given. The third shot can be given to you when it's been at least 4 weeks since your second shot, if you are considered immunosuppressed based on the criteria determined by the CDC. So that's kind of when you can actually safely get your booster. But of course, many people who have gotten their booster had their shot, months ago. Can I get an additional COVID-19 shot if I've received the Johnson & Johnson vaccine? And so this is where, right, again, we have to timestamp this slide because right now the answer is there's no current recommendation for an extra dose if you've received the Johnson & Johnson COVID-19 vaccine. The CDC will come out with additional information over time. But right now, if you did receive the J&J COVID-19 vaccine, right now you do not need a booster. And then who should not get a booster shot right now? People receiving a stem cell transplant or CAR T-cell therapy should wait at least 3 months after that treatment to get vaccinated. A lot of times it's because when patients undergo this type of therapy, you're basically getting rid of the entire immune system. And so I think, obviously doctors want you to be able to mount an immune response for the, to the vaccine to get the antibodies. And then, gosh, this was something that came out on Friday. But the FDA convenes a panel of experts to help with their recommendations. And so this isn't an official FDA recommendation, but this panel of advisors did review the data, and this was their recommendation. And that was for patients who are not immunosuppressed. So we're kind of talking more general population, that they're recommending COVID boosters for those 65 and older, which already kind of puts you into that slightly higher risk category. But they are rejecting at this time broad approval. And I think that this is obviously something that will continue to be discussed. Again, this is not an official guidance from the FDA, but this news headline did come out on Friday. So if you are kind of at normal risk, which means you're a healthy 55-year-old adult, that the FDA advisors are not recommending a COVID booster at this time. But again, we'll kind of await final word from the FDA because this was simply the panel of experts that was convened for this. In terms of where we are, right, with COVID-19 vaccinations in our state, right, we see still a majority of our population having been fully vaccinated. There's a percentage that are partially vaccinated, and then there's certainly a population that is currently unvaccinated, and that's in the blue piece of this pie. And of course, the population under 12, there's no approval at this time to proceed with vaccination as they're still looking at safety in the population under 12. But we'll see, there's some estimates to say that children under the age of 12 may get vaccinations, as late as early 2022. There's some hope that maybe they may be able to offer these vaccines for kids at the end of October. But again, it's kind of a moving target, and I don't think anybody really knows the right answer to this question. So that's what I got for you guys. Just to wrap up, right? I mean, certainly we all understand that the COVID-19 Delta variant has led to yet another peak in cases and hospitalizations, and you've seen that data. Vaccinations certainly not only reduce, but significantly reduce the chance of hospitalization and death, but there are breakthrough cases, and we've certainly seen that. Booster shots are currently recommended for patients that are immunocompromised, and it's unclear if boosters will be recommended for the general public at this time, but we'll just kind of have to see what comes about with the news. So. Just a thank you for, there are a lot of people who actually help provide this data, and also to Tom Campbell, who is our infectious disease expert and director of clinical research at UC Health, and certainly was kind enough to review these slides. And then certainly, understand that this has just been an ongoing pandemic that never seems to end. There's certainly resources in many different places for COVID-19 support. The School of Medicine has COVID-19 support at this URL kind of seen here. And then there's always up-to-date information with cancer and COVID-19 from cancer.org. So with that, I will stop sharing my slides and happy to take any questions that you guys may have. And also happy to wrap up earlier if there are not that many questions.
All right, awesome. Thanks, Chris. And my camera was working there for a small stint and then it stopped again. So sorry about that. Chris, this is awesome. And I want to remind everyone, if you would like to come off mute and ask a question, just pop your name in the chat box so Aaron and the team can let you in. If you have any specific questions, Aaron, I don't know that I see any directly in the chat at this time unless I missed them. So Chris, one of the things these were just a few random questions that came through. There was a question that if you are under 18 years old and you want a vaccine, will it require patient or will it require parent consent? And I don't know the answer to that. I don't know if you know that anyone, given that the recommendation is now for what, 12 and over, if a kid wants to independently do that, does it require parental consent? Do you know?
So I don't know the answer to that. It's actually a great question for my colleagues at Children's Hospital, since they do that. If I had to make a guess, and I'm afraid to be really, really wrong here, I would say the answer would be yes, that you would need a guardian sign off for that. But I'd have to ask my friends at Children's Hospital Colorado. And there are also, honestly, maybe people on this call that know better than I do.
Okay, good. And I realize I shouldn't know the answer to that too. So yeah, that's definitely something. Chris, I guess a number of the folks that we're working with right now are screening navigators and folks that are also working the field for cancer prevention. Anything, I guess, otherwise, if folks are vaccinated, getting in for screening, at this time, I think part of the questions is, one of the questions is, are we expecting to see anything like another cease in elective procedures coming? Do we think anything like that in terms of, even though we see like this uptick of what's going on with the variant, do you think there's, and we don't have a crystal ball, but what's your sense of what does that mean for, 2 to 3 months from now?
Yeah, so that's a wonderful question. And really, right, when you think about where we were in the spring of 2020 and in the wintertime, we really were basically canceling all elective procedures. Anything that would require a hospitalization after an operation, and the reason why is we just simply didn't have the beds for it. I think hospitals have become really, really adept at managing beds and limiting certain elective operations as needed whenever there's a bed shortage or an ICU shortage. And so to that point, here at our hospital, and I'm sure this is the case at all the hospitals across the country, we have actually been delaying some surgeries that are not necessarily deemed critical. Now, fortunately, right, cancer surgeries really kind of fall into the critical kind of part. So I have not had any patients have a delay in terms of that, but there are some cancellations because, again, some of these beds, particularly the ventilators and the ICU beds, are in such short supply. But I think that honestly, all the hospitals have gotten really, really good at honestly managing this on a day-to-day basis.
Okay, great. So Chris, I know that we have talked a little bit about, boosters, but I think there's even patients that we're encountering who might have a new diagnoses or, people who haven't necessarily been vaccinated as they're starting treatment. Is there any recommendation or is there a current guidelines that if people haven't been vaccinated but need to start treatment, what should come first? Is it a vaccine required before treatment starts? What is the sort of lay of the land as it relates to starting a new regimen and where vaccines fit in?
Yeah, I mean, I think that there's some anecdotal evidence, right, in terms of trying to get the vaccine in before you start therapy in order to mount the correct immune response. A lot of our chemotherapies don't necessarily wipe out your immune system like a stem cell transplant, right, where you're like getting rid of all the white blood cells, essentially in the body. The simple answer is really just get it whenever you can get it. And I wouldn't worry too much about the timing, either before or even after starting therapy. The reason why I say that is because I've vaccinated a ton of patients, even while they are in the middle of their therapy. and honestly have not seen really anything bad come from that. So I would just say, right, when's the best time to get the vaccine is, whenever you can get it. The other thing that this just reminds me of course, is, we're kind of getting into the flu season. It's amazing how little flu we actually saw this past winter. But I would also just, again, especially for those patients that are undergoing therapy for cancer, not only is the COVID-19 vaccine recommended at this point, right, if you're under active treatment, probably the booster, right, as well, but also to get the flu vaccine as well.
Okay, great. Well, from all of us working at home, I have a dryer that's singing to me right now. So just one moment. So I just want to encourage anyone, if you have a question, if you have a comment, let us know so that we can bring you off mute. Chris, I guess, as we're starting to round out, I'm not seeing a ton of additional questions or comments coming through. I guess, you gave us a closing comments in terms of like who should be careful. I think the point around flu and the vaccine and how that all fits. I guess so for so many of the people that are working in primary care or navigating patients, any final words of wisdom or anything that you would stress as we start to enter into the fall?
Yeah, I think, right, especially if you're navigating patients that are newly diagnosed, if they haven't been vaccinated, understanding that, right, if they're going to undergo any type of treatment, that puts them into an even higher risk category. So certainly to encourage that, to encourage the flu vaccine, we just obviously want to keep people out of the hospital. I think if you're in healthcare, this is probably a situation where a booster also would be recommended in the healthcare setting, right? And so to that point, even though I'm not over the age of 65, at least yet, I did get the third booster just because, again, our patient population is susceptible, and just trying everything that we can do on our end to prevent COVID or to prevent passing COVID along, obviously to a vulnerable population. And so just kind of something to keep in mind. And also, right, if you have any questions, even after this webinar, feel free to reach out to me directly. And I think that the slides that I showed you are going to be made available as well.
Okay, great. I do want to say there's one other question that's come up in the comment, and then Emily had shared that she does believe that consent is needed, but even an over the phone consent from guardian or parent might suffice. So we will definitely follow up, and thanks, Emily. Christy noted, is there a benefit to wait longer after the second shot to get the booster if you are eligible?
Yeah, right. And that's a great question, Christy. And so certainly the recommendation is that don't get the booster until you're at least 28 days or 4 weeks away from your second shot. And I think, the data really shows that, you're going to persistently have a good amount of antibodies at a minimum for the subsequent, right, 6 or 8 months following your last dose of the COVID vaccine. So, right, if it's been 4 weeks after your last dose, I'm not necessarily sure you need to go out and run and grab your third booster. That's just kind of like the minimum amount of time. But I think what, the concern is that after you get past 8 months, that, the studies show that the amount of antibodies that are in somebody's system start to, decrease. And so that's usually where people get their booster shots, but waiting a couple months is probably recommended.
Okay. There's a question, is validating I guess probably the comment that Moderna is better for Delta than Pfizer. Is there any truth to that?
They're pretty similar. Depending on the study that you look at, there may be one that's several percentage points higher than another, but I honestly think that that's probably insignificant when you kind of look at the real world. And so I would say both would be, right, seem to confer protection against the Delta variant, even the Johnson & Johnson. And so while I would say there may be slight differences depending on the study that you look at, I wouldn't necessarily consider one to be truly superior to the other.
Chris, what about and I know there's some data that's showing that even probably having a natural immunity for those who did have COVID, there was some discussion about, that protection from having the virus getting better, having that built up immunity, and like a built up natural immunity versus the actual vaccine, or both. What is your sense of like where that fits in terms of if you had it, do you need the vaccine? is a vaccine, or like, do they work better? Like, what's the general sense of that right now?
Right. Yeah, no. And, with COVID, when you actually get COVID and develop antibodies that way, that's definitely going to give you a certain amount of protection, right? Now, the antibody responses to actually having COVID are going to vary. And then how long you have those antibodies for is also pretty variable. And so that's why the recommendation is, right, if you have COVID, you got to wait several weeks until you actually get the vaccine so that you can mount appropriate response again and get the antibodies that you need. But even if you've had COVID, you're still recommended to get the vaccine again to get that longer lasting protection. And because eventually, right, the chance that you're going to have another case of COVID is certainly up there as well.
Okay, great. Good advice. Okay. Well, it looks like that is all we have. And I would have to say that we're bringing back Chris several times by popular demand and great reviews. So Chris, this probably won't be the last time that we hear from you, but a million thanks. I know many of you who are working in the healthcare system settings, providers like Chris who are working with patients every day. Thank you for all of the great work. Those who are working with COVID patients and the screening. I just want to remind all of our folks that we do know, of course, there's been such a backlog of preventive screening services and delayed care that as much as we can get that message out about the opportunity for screening, prevention, early detection, and sticking with treatment and regimens as much as we can while appropriate, it's a huge part of making sure that we are diligent about thinking about cancer prevention and control. So with that, thank you a million. We will be sending out the reminders. Today's presentation will be recorded. Chris, a million, thank you. Thank yous for all of your time.
Absolutely. Thank you guys, and hang in there. And like I said, right, I mean, we're probably past our peak here. So I do hope that things will get better over the coming weeks, but just keep up the incredible work that you guys are all doing. And thanks for taking the time out of your day.
Great. Thank you. Have a great day, everybody.
Bye, everybody.